How is a dementia diagnosis confirmed by doctors? Imagine trying to solve a complex puzzle where each piece is a different test or assessment. That's how doctors confirm if someone has dementia. There isn't just one simple test that can give a definitive answer. Instead, they use a combination of detailed evaluations to piece together the full picture. The process starts with a thorough review of the person's medical history and symptoms. The doctor will ask about when symptoms began, how often they occur, how severe they are, and how they affect daily life. Family members or close contacts are often involved because they can provide insights into changes in behavior or abilities that the person might not notice themselves. Next, the doctor will perform cognitive and neuropsychological tests. These are specially designed assessments that measure thinking skills like memory, reasoning, language, attention, and orientation. They help determine if there is cognitive decline and how much it has progressed. Alongside these tests, a neurological exam is conducted. This involves checking reflexes, muscle strength, coordination, eye movements, speech, and sensation to see if there are signs pointing to brain issues beyond typical dementia. Brain imaging is also a key part of the diagnosis. Structural scans like magnetic resonance imaging or computed tomography help rule out other causes such as tumors, strokes, or head injuries. Advanced imaging techniques like positron emission tomography scans can reveal patterns of brain activity and identify the buildup of proteins called amyloid or tau, which are linked to Alzheimer's disease. Biomarker testing has become increasingly important. Blood tests can now detect specific proteins associated with Alzheimer's, allowing for earlier diagnosis. Cerebrospinal fluid tests, obtained through a lumbar puncture, can measure levels of amyloid and tau proteins in the fluid surrounding the brain and spinal cord. These markers help confirm whether Alzheimer's disease is present. Doctors also run routine blood tests to check for other conditions that can mimic dementia symptoms, such as vitamin B12 deficiency or thyroid problems. Sometimes, a mental health evaluation is necessary to rule out depression or other mental health issues that can cause memory problems. Recent advances have introduced specialized criteria to distinguish different types of dementia, like limbic predominant age-related TDP-43 encephalopathy, which requires specific imaging and testing. The diagnostic process now often involves both primary care doctors and specialists like neurologists, psychiatrists, or geriatricians. If initial tests are inconclusive but symptoms worsen, further testing or a second opinion may be needed. In summary, confirming a dementia diagnosis involves a careful, multi-step process that combines medical history, cognitive testing, neurological exams, brain imaging, biomarker analysis, and blood work. This comprehensive approach helps ensure an accurate diagnosis, which is essential for planning appropriate care and treatment. Remember, each person is unique, so it's important to work closely with healthcare professionals for personalized advice.